Hey guys, Tony Maritato here, physical therapist. So in this video, what I'm actually going to do, this is a brand new video format. I'm going to review a video I shared, I don't even know when, months ago, maybe a year ago. This patient behind me on the screen, this is her very first outpatient physical therapy visit after a left total knee replacement. Now, I think we were 10 days post-op. I do not believe she received home health when this procedure was done. So you're getting a chance to see me in the clinic, not because I'm an amazing therapist, but because I want you guys to see what to expect and what one therapist does on day number one. Now, of course, everybody's going to be different. Patients are starting in all different levels. So this particular patient is representative of many of the patients that I see for the first time in the clinic. They come in pain, they come in fatigued, they get tired with very little activity, usually because there was blood loss, they're low iron, maybe they're anemic, they might experience episodes of nausea. I'm not pushing them day one in physical therapy. I'm barely even stretching the knee. The goal for us, me and the patient you see here, is to establish a baseline, get an idea of how things are progressing, make sure there's no signs of infection, make sure there's no signs of a blood clot, answer questions for the patient so that the patient has a little bit of peace of mind, let you, the patient, know what's normal, what's abnormal, is this, what other people feel, and maybe give you a couple tips for things to make life easier at home. So I want to go through the video with you. I want to highlight what we're doing, why we're doing it, from a third-party perspective, just so that you can see. So I'm going to play the video. I'm going to let the audio come through. I'll stop it here and there to let you know what I'm doing. So just come along with me.
Okay, so what I want to do is I want to get closer to the sink.
So the first thing that I like to do is I start at the sink. The sink is the same sink you're going to have at home. It's a stable countertop. It gives you something strong to hold on to. You can see how she's very hesitant to put weight through the surgical leg. You can see she has the TED hose, the compression stocking on. She's still got the non-skid socks that came from the hospital. And she's just very tentative, which is normal. If I went through this procedure, I would be terrified because I wouldn't know what to expect. So listen to the audio.
And then you go back to the left.
What we're doing here is we're shifting weight side to side. We're trying to go on the non-surgical leg, which is her right, onto the surgical leg. I'm allowing her the opportunity to say, okay, what does this feel like? What's going to happen? Let the nervous system, let the brain kind of process, hey, I'm putting weight on my surgical knee. It's not buckling. It's not even hurting. It feels the same. If anything, it feels better. We're building confidence.
Feel like when you're on the left?
I felt a circle around the knee.
Sure.
And I don't have a shooting pain or anything.
So she just said, I feel a circle around the knee. I don't feel any shooting pain or anything. And that's really what it should be like. We want you to understand, hey, this is okay, it's safe, the prosthesis is in place, this was a cemented implant, it's not going anywhere. And so, this is how we begin the process of building confidence so that you can walk more normally, you can get around the house, you know what you can do.
And I'm recording these so you can see them later.
So now you can see she's starting to actually put even more than 50% weight. She's doing what we call a side-to-side heel raise. So the left knee heel is up. Now the right knee heel is up. That forces more of her body weight onto the left. This starts to get the side-to-side weight shift that you're going to need for normal ambulation, normal walking. At this point, she's absolutely still using a forward wheeled walker for all of her mobility. But within a couple days, in this particular case, we went from the walker to a cane, then we went from a cane to unassisted.
Just behind you in case you get dizzy or lightheaded, you can just take a seat.
So I'm just saying in the video, I've got the chair behind you in case you get dizzy or lightheaded. Like when you're 1 week post-op, a couple days post-op, your body is not prepared for high intensity exercise. You do become short of breath. You do become lightheaded, nauseous, quickly and unexpectedly. So we want you in a position where you feel safe, where you know that you're being monitored, you know that you're being paid attention to. So let's see what we're doing here.
Now what you're going to do, you're going to hold on to the counter. You can lean on your forearms, your elbows, whatever you need to. And basically,
I just make me go backwards, aren't you?
1 foot at a time. So you're going to take the left foot forward or backward.
Okay, so now we transition from side to side weight shift to front to back weight shift. Again, notice we're progressing toward walking. I have her place her surgical foot back because that allows her to control how much weight she puts through it. She's leaning on the countertop. She's supporting through the non-surgical leg. When she put that left surgical leg back, there was no weight through it. It's just the movement. Now she's going to begin loading that leg a little bit. So as she bends the right knee, it forces the left knee to accept the weight. She's trying to figure out in her head right here, how do I move my right leg? And she just did it. That was a huge milestone for her because she was terrified to let the body weight go through the surgical knee. Now she just brought it back up. And so this is a real person in real time. This isn't me trying to demonstrate, me, the person who's never had a knee replacement. You can see the bruising on the inside of her left knee, the discoloration, all of that stuff is totally normal. It's going to be different for different people. So, you know, this is absolutely one of my favorite ways to help patients really start to gauge what the knee can handle. You know, and we know the knee is solid, the knee is safe. I think we expect more pain than actually happens with these activities. I'm not saying it doesn't hurt, but I'm saying that the fear of the pain is what limits the mobility, limits the weight bearing more than the actual pain itself. And from 15, 20 years of experience, that's just what I've seen practically in the clinic. So guys, I hope this kind of information is helpful. I hope those of you who have not had your knee replacement done yet can see something like this and start to get an idea, okay, what's going to happen in therapy the first couple days, the first week or so. It's this kind of stuff. You know, it should be very low key. I usually personally start with very short sessions. I explain to all of my patients, hey, I want you to come in. I want to be able to see what's going on. I want to put your mind at ease. But I want you to understand that when you leave, you're going to feel like, I probably could have done more. That's perfect. That's enough. That's all we need. I don't want you to be exhausted. I don't want to increase your pain levels. I don't need you to push yourself during the first week or two after surgery. That is the time to allow your body to recover. That is the time to allow you to figure out what the knee can handle and to build confidence. So much of this is about building confidence, and that comes from understanding, hey, what is this going to feel like? You know, what's it going to feel like if I put my foot on the ground? What is it going to feel like if I put my body weight through it? What's it going to feel like to get on the commode, to get on a couch, to get in and out of bed? And then, of course, how do I do these things correctly so that I'm producing new habits that I'll use while I go through the recovery process? So guys, if this kind of video is helpful for you, let me know. Post your comments down below so that I can better guide the videos that I make to help you guys have a better outcome and better long-term patient care experience. As always, I appreciate if you like the video, subscribe to the channel, and I'll catch you on the next one. Thanks for watching.